Now I want to look at some other compounds that are used for imaging. That's like they apply to the humans. So when they apply to the humans, if you do an imaging, you see that that part of the body gives you a more detailed outlook. Okay. So one of these compounds is what is known as what? The gadolinium. Okay. So this was an imaging that was done without gadolinium, and the other side is an imaging that was done with what? Gadolinium. So the gadolinium, this is how it looks like. So let's look at it. Gadolinium compounds, they are widely used contrast agents, okay, used in MRI scans. So they enhance, they make it that what blood vessels, tissues, and abnormalities, you can view them very well, properly. So gadolinium-based contrast agents, they are chelates of gadolinium, which is a rare earth metal. It's found to carry ligands, okay, to reduce toxicity. Okay, it bound to carrier ligands. Sorry, it bounds to carrier ligands. So role in imaging is they are primarily used for MRI scans, right? And they used to actually make some one or two parts of the body appear more clearer for proper diagnosis, right? So gadolinium shortens the relaxation time of nearby water protons, making tissues appear brighter on MRI scans. So types of gadolinium contrast agents: we have the linear agents, they bind in a linear structure. We have the macrocyclic agents, they bind in the ring-like structure. Examples: we have the Gadopentate, Gadopentate, dimeglumine. This used to be this Gadopentate, dimeglumine. Then we have the Gadobutrol. We have the Gadopentate meglumine. This one is a gadodiamide. Okay, so they are mainly used for all those brain imaging of the heart, that's cardiac MRI, vascular imaging, that's vascular MRI, for also cancer assessment. So they can cause nephrogenic systemic fibrosis, so you should know the exposure of a patient to it, gadolinium retention in the brain and body, allergic reactions, and so macrocyclic agents are actually more preferred because lower risk.